Welcome to the Susan Brender Show. It's all about you, featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
I'm Susan Brender, and this is the Susan Brender Show. Today we have a repeat guest on our show by the name of Scott Miller, who's a physical therapist who believes where fitness and wellness meet. Scott is a licensed physical therapist in the state of Florida and an active member of the American Physical Therapy Association. He's a certified health and fitness instructor by the American College of Sports Medicine and CPR and First Aid, certified by the American Red Cross. Now, I don't want to give you any more information about Scott because he has so much to talk about and so much to do to help you understand what is a physical therapist.
Well, thank you very much, Sue, for having me on your show again. I always enjoy being a part of this great show, and given my knowledge and expertise on physical therapy and injury, I'd be happy to answer all the questions you and your guests have for me. Basically, a physical therapist, we're highly educated healthcare professionals who help patients reduce pain and improve or restore their mobility, usually in the cases without the expensive surgery and often reducing the need for some long-term use of prescription meds and all their side effects. So basically we're really trying to help restore their normal function back again.
Yeah, I know we've addressed this question before, but I really have to understand. You know, some people, when they have back pain or they have pain in their legs, their arms, parts of their body, they often have to say to themselves, okay, what do I do about this? Do I go to a chiropractor? Do I go to a physical therapist? Do I go to a regular sports medicine doctor? What would you say to that, and how would you answer which is the best approach for people to take?
Well, a lot of it comes down to the type of pain that they are experiencing and how long they've been experiencing this pain. And usually the first approach really would be to seek some attention from their medical professional. And in most cases, after some diagnostic tests are done and we can determine exactly what is going on, in most cases, physical therapy is going to be recommended for a patient to help with their overall mobility, help with the pain, and really get them back to returning to their prior level of function and permanent relief of some of the symptoms that they're experiencing.
Yeah, so that leads me to the next question, which may be, actually the same thing that you just answered, but what can a physical therapist do that most people are unaware of?
Well, we, a lot of patients have misinformation on what a physical therapist does, and they think it might just be for the elderly to help maybe someone to relearn how to walk after a major injury. But basically, we are going to use a lot of different treatment techniques, including a lot of our the skill part of physical therapy, which is a lot of hands-on manual treatment to treat the condition, whether it's low back, hip, knee, shoulder, neck, foot. And we're also going to be using a series of different modality techniques that will, are used to help bring blood flow to a joint, help with mobility, and of course help reduce pain overall.
Yeah. Now, I'm going to ask you, which everybody knows that diet and exercise is a very important part of being healthy and having healthy bones, healthy muscles, that sort of thing. But what kind of exercise should everyone do? Everyone. I want to know from a kid to a octogenarian. If you had somebody on your table, and doesn't matter what age, what exercise would you recommend?
Well, that's a very, very difficult question because from one patient to or one client or one individual to another individual, they could be the exact same age and have a very similar history, but they've have undergone a lot, several different activity levels throughout their life. So one exercise might be really good and enough and start to improve someone's mobility, whereas that might not be the right movement or exercise for another individual. So that's a part of what physical therapists do, is we really try to individualize every single program to each and every specific individual based on their history and based on their specific pain, movement pattern, and their most important is their level of function.
I hear you. Now, what will a typical session look like? I want you to kind of set the stage for our audience. If it was almost like a show, I want you to start with what it looks like. Just give us.
Well, every physical therapist or physical therapy clinic may have their different protocols and their different techniques that they use. But in my private practice, a patient will always have to come in for their initial evaluation, where we're going to do many tests and measures and take a pretty extensive history to determine exactly what is going on with that specific patient, and we will develop a detailed physical therapy plan of care for that individual, and we will cater their plan and program to them. Usually on treatment days, patients are coming in for what we start with is some modalities, whether it's electrical stimulation, ultrasound. We use cold laser. We're going to be doing quite a bit of hands-on manipulation and massage to the specific body part that we're working on. And then we're going to get into, and usually the last part of treatment, the entire second half of the treatment, usually focuses on stretching and exercises and educating the patient on what needs to be done when they're not in the physical therapy office, because it's very, very important that these exercises are taught to the patient and not just done when they're here for treatment, and it's an ongoing process for them to continue becoming more mobile and stronger.
If they start out with you, what should they really expect from you? What should they feel is the right approach for them when you start to kind of find out a little bit more about their bodies? Because people have high expectations, and should they?
Absolutely. They should have high. Most patients have high expectations, and other patients have been dealing with pain and dealing with their condition for several years and have not been helped like they may have wished they could have been helped, and they may not have as high of expectations. I try to set the bar as high as I feel that we can achieve, depending on their specific condition, based on diagnostic tests that they've done, based on their prior level of function, based on their current level of function, and we really do our best to try to set realistic goals. And within 2 or 3 weeks is when I usually tell a patient that we really should be on the right track and really seeing some good improvements at that point, whether they're at 30% better or 80% better. If we're on that right track, we're making the right steps. And every single patient progresses differently. Some can progress very quickly within just a couple treatments, and some, depending on their prior level of function, it just certainly may take a little bit longer.
Yeah. Do you have a treatment philosophy at all?
Well, my treatment philosophy for most patients, one is to monitor their tolerance to treatment, and that is a big problem in any industry, whether it's medicine, whether it's chiropractics, whether it's physical therapy, and whether it's just personal training. You really have to monitor and observe and see every single patient's response to what you're giving them, because an abnormal response can really send that treatment plan in the wrong direction. So, part of that is not just watching their response, but also listening and educating them on what they need to be feeling and what they should be expecting, because they're only with you for a short amount of time each week, and they need to be doing a lot of these things on their own.
Yeah, and Scott, a lot of people who have diseases like MS or what some of the other diseases I want to mention, but I know that MS patients need a lot of physical therapy. Has there been a progression in the way treatment is given to people with all these horrendous diseases?
You know what? There's not been a tremendous amount of differences with treatments that we've done in the past, except there are some new technologies and new modalities that have come out for pain relief. And maybe help promote healing. But specifically with MS, the main importance is to, obviously, again, goes back to monitoring the patient's response, because with MS, if you overdo it, if you overexert a patient, you're gonna see a negative response to the treatment. And again, you need to give them the right amount of exercise that's going to help their condition and not make it worse. So it is a very tricky and difficult illness to treat, but you really need to monitor and educate the patient on what they need to be doing, and it all just comes down to working on their specific symptoms.
Yeah. And what happens if somebody's in a car accident and, unfortunately, it's not an easy one to take care of, but if they come and see you, do you feel that you can try to get them well sooner than later, or is it a really long process?
And it goes back to the other things that I was saying about every single accident, every single patient that's involved in an accident presents completely different. So it could be a very similar type of accident, and one patient progresses very, very quickly, and their body's healing properly, and they're compliant with the exercises, and you can have them on their way back to their prior level of function rather quickly. And then there's other patients that, their condition certainly lingers on for longer than, both the patient and the therapist would like. And sometimes you need to readjust their treatment program, and that is in conjunction with the entire medical team. So between their physician, and if they're seeing chiropractic treatments as well as us, we all have to kind of coordinate treatment. And if things are not working, we need to change our approach and treatment plan.
I'm sure that you've had experience with actually physical therapists taking care of your body, because you're a sports person. You're a major tennis player, and you probably play a lot of other games. Have you experienced going to a physical therapist, and what has that taught you?
Absolutely. Well, that was probably the catalyst that got me into the field of physical therapy. When I was in college playing athletics at college, I had torn my ACL and needed to have surgery on my knee and undergo physical therapy for probably 6 months to 8 months, and that really was the start and the introduction to physical therapy that got me where I am now.
Yeah, that's interesting. Now, I'm sure, and this might be a little unusual as a question, but have you ever experienced something funny in your practice that stands out in your mind, something that happened? Because we're talking so seriously. I'm sure that there's something funny that you've experienced, and I'd love our audience to know about it.
Oh, that's definitely the first time I've heard that question. As far as funny, I know we come across all different types of people and all different senses of humor, and we can probably write a book of all the different personalities that we have come across in our office, both really, really good and not so good. So it is a medical facility, so we really try to keep things on the up and up here, but we do have quite a bit of fun and enjoy a lot of the patients' personalities that we get to see on an everyday basis.
I'm going to put you on the spot. Give me one person who stands out.
That would be putting me on the spot. And I'm not sure I can really answer that specific question. it is that is a tough one. Maybe one specific patient I can think of right now. The gentleman suffered a stroke, and all the poor guy wants is a beer, and his wife and his aide will not give it to him because of his condition and because of his blood pressure. And I think that we may make his wish come true on a certain day this month. So that's he deserves it. He's been working really hard, and he brings a smile to all our faces here.
Well, that brings up the question also about very young people. In fact, let's even talk about some football players. In the papers recently, they've been talking again about injuries that different sports people sustain, and I'm sure you see a lot of that. And what would you recommend that they do that they're not doing now that they should do and that people will benefit most by?
Well, I know personally, a gentleman that I do know, his son was involved in a pretty major football accident and had to undergo brain surgery this year, and it was from an impact to the head. And changes need to be made at the middle school level, at the peewee level, at the high school level, and start at that level that will trickle all the way up to the professional level on different ways to protect these kids and these athletes from potential devastating head injuries. And whether it's changes in the way that tackles are made or hits are made, but changes definitely need to be made.
Yeah, I hear you. So what doctors do you work the most with? Is there any particular doctor that stands out?
A specific name of a doctor, or just a general?
Just, what type of doctors are sort of your part of your team, if you will, that you depend on giving you customers, if you will, clients, and also
Sure.
You have to work with in conjunction with the person's injury?
Since we do primarily do a lot of work with injuries of joints and muscles and bones, we do generally work and see a lot of patients that have come from orthopedic surgeons, whether it's to help prevent the surgery, or we see patients post-operative after surgery, just like myself with my knee. And we also do quite a bit of work with the primary care physicians here. The primary care physicians is usually the first stop that is the first medical professional that a patient will see, and we have a very good relationship with. So sometimes they can bypass certain steps and get patients in for treatment sooner by going right from the primary care physician to a physical therapist. So if there is someone that feel like they may need physical therapy, their primary care physician can write a prescription for physical therapy. But also here in Florida, a prescription is not needed. We have something called direct access to physical therapy, where a patient can come without a prescription and come right off the street to receive physical therapy treatment.
Scott, it seems to me that there are a lot of alternatives that people need to know about or to follow, like hydration and, exercise, of course, and needless to say, various other alternatives, food, good, we'll go back to exercise again. So if you give people a little bit more information about what alternatives really impact the way that you feel and how physical therapy just adds on to making it better.
No, absolutely. The body is a very, very complicated machine, and in order for it to be working properly, every single system in the body really needs to be working at optimal performance. So, with physical therapy, we really work closely on the muscular system and the joint system, the bones, and we really focus on keeping that area strong and mobile. But the body has many, many other systems and is primarily made up of water. So, we really try to educate our patients and try to focus on patients patients being as hydrated as possible. And in most cases, patients are not drinking enough water, and dehydration could lead to a multitude of illnesses and conditions, and it can lead to dehydration, and dehydration could lead to muscle weakness, fatigue, and a whole host of other conditions just by not drinking enough water. And that kind of leads into the whole nutrition aspect of wellness. And what you put in your body is very, very, very important, and can actually help or hinder what physical therapy does.
And a proponent of medications?
When it's needed, I am, and there is certainly a time and a place for medication and certain medications, and I really do believe that a coordination of care when it comes to medications needs to be established, because there are lots of side effects to several different medications, and several medications interact with other medications differently. And when patients are taking a multitude of medications, they need to know the different side effects, which could affect their overall function, could affect their muscular condition and pain as well. So there is a time for certain medications, but at some point, if it really needs to be addressed.
Okay, well, we're just about done. So what I want to know is if people want to know certain kinds of things about physical therapy, do you provide them with any information, and how else do they get in touch with you? Scott Miller of Miller Physical Therapy, located in Delray Beach, Florida.
Absolutely. Physical therapy, is accessible pretty much in every single town in the entire, United States, and even throughout the world. My specific physical therapy practice is located in Delray Beach, Florida, right in the downtown Delray Beach area. And but if you're not from this area, there's a lot of really good resources online, including the American Physical Therapy Association, apta.org. There's a plethora of information on there regarding physical therapists, and there's a really good link and resource on that website to help you find the right physical therapist based on your geographic location. I'm always available, or one of my therapists is always available to speak on the phone and do consultations over the phone, or if you're in the area, certainly set up a consultation in person. But I'm available via email or phone call, and it's Miller Physical Therapy in Delray Beach, and I'd be happy to help anybody out and answer any questions.
Today my guest has been Scott Miller from Miller Physical Therapy. He is full of so much information that so many people need, and he produces a newsletter. And Scott, if people want to listen or read your newsletter, can they? And it doesn't matter whether they live in Delray Beach, Florida?
No, absolutely not. We have subscribers to our newsletter throughout the country, and actually throughout the world. And basically, all you need to do is get on our website, which is www.miller-pt.com, and that's Miller Physical Therapy in Delray Beach. And you can sign up for our newsletter right on our website. And we also have a really nice blog on our website as well, that we provide some really good information that is in addition to our newsletter. And all you have to do is just input your email, and you'll get our monthly newsletter.
And I want to thank you so much for being on the Susan Brender Show. But before I finish, I want to say that Scott is going to be on again probably in January sometime, and he's going to help me interview a sports person. So it could be a really exciting show, and I want you to kind of keep your eyes open and your ears open to listening to the show again. So thanks again, Scott, for being on the Susan Brender Show.
No, thank you very much for having me again. I always enjoy being a part of your show, and I look forward to helping you interview the athlete that we're going to be bringing on to the show.
That's great.
Thank you for listening to The Susan Brender Show. To be a guest, email sebrender@yahoo.com.